Heart attacks are the #1 cause of death in the United States, along with other cardiovascular diseases. The most common cause for a heart attack is a clot, which becomes dislodged from a blood vessel and propagates or flows through blood vessels that end up supplying the heart. Those are called the coronary arteries. There are several issues that may form the basis of a medical malpractice claim involving heart attacks. And they start at the beginning, which is screening patients for heart attack, screening patients for something called coronary artery disease. Coronary artery disease essentially refers to a disease of the blood vessels of the coronary arteries. And the way that screening gets done is first with things as simple as EKGs, and it may also develop into something called the stress test. And many people are familiar with this type of test, but for those who are not, a stress test involves patients walking and then running on a treadmill while their heart is being monitored for signs of ischemia. Ischemia refers to low blood flow to the heart muscle. Now, the reason it's so crucial to screen and identify patients who may suffer from coronary artery disease is that if a patient is found to have it, there are things that could be done to prevent and reduce the risk of a heart attack that could be devastating to the health and potentially the life of a patient. These things include stenting procedures. Stenting procedures refer to cardiovascular procedures which help place a stent to open up a coronary artery so blood flow could be restored to the heart. Other things that could be done are certain medications that can be given. That's the first type of case that may exist in cases involving heart attacks. The other type of case may involve the actual heart attack. We've had numerous cases involving patients who present to the hospital with certain signs and symptoms that are consistent with a heart attack. Obviously, this may include chest pain, but all doctors are trained that patients may have back pain as well if the heart attack involves another part of the heart, the lower part, for example. In many of the cases that we've had at our office, we've had patients who presented with these symptoms and were either simply turned away or were not given the appropriate testing at the hospital, which resulted in devastating effects on their heart and health and/or their life. We've had quite a few who actually passed due to their failure of healthcare providers at a hospital to properly test them for a heart attack.